Assalamu alaikum and welcome to another video of Learn with Larib. Today we will be starting another topic, central nervous system. We'll be starting off with a recap of embryology. So in the third week, we have three germ layers developed, which is ectoderm, mesoderm, and endoderm. Ectoderm, some part of it then further develops into neuroectoderm. So what happens is that the underlying notochord converts the overlying ectoderm into the neuroectoderm, which in turn then changes to neural plate, and then a neural groove is formed. That neural groove, those are little cells, they fuse to form a neural tube, and some of them are left as neural crest cells. First, we will go with the derivatives of neural crest cells. From neural crest cells, let's start from the very beginning. Let's see the skin. We have melanocytes developed from neural crest cells, and then moving downwards, we have in brain the pia and arachnoid matters. The dura matter develops from mesoderm. If we talk about bones, we have the bones of neurocranium developed from neural crest cells. Coming to neurons, we have ganglia. All the peripheral ganglia are developed from neural crest cells. Other than that, from if we talk about glands, we have adrenal medulla, which is developed from neural crest cells. Other than that, we have parafollicular C cells, which produce calcitonin. They are developed from neural crest cells. We have adenoblasts, and then the most important thing, we have the Schwann cells. All right, let's talk about neural tube derivatives. From neural tube, we have the CNS, the brain, and the spinal cord. Then coming to the eyes, we have retina and the optic nerve. Regarding the cells, we have oligodendrocytes. Schwann cells were from neural crest cells, and so oligodendrocytes are from neural tube. And we have astrocytes. Failure to do so would obviously result in abnormalities. And that is why having folic acid is very important, especially at the start of pregnancy or pre-pregnancy. So if there is a failure of closing rostral neuropore, the baby might develop anencephaly, polyhydramnios in the mother with increased alpha-fetoprotein and acetylcholine esterase. If the caudal pore is not closed, there will be spina bifida and increased AFP and acetylcholine esterase. Now coming to this part, so this is the neural tube, which then further develops into 3 primary vesicles and then 5 secondary vesicles. The forebrain, which will be the cerebral hemisphere and thalamus, is firstly developed as prosencephalon. So prosencephalon is then further divided into telencephalon and diencephalon. Then the midbrain is mesencephalon. Again, the midbrain will be formed from it. The hindbrain has pons and cerebellum and medulla. It is formed by metencephalon and myelencephalon. The cerebral hemisphere from telencephalon will have the ventricle, which is lateral ventricle. Thalamus will have the third ventricle. So cerebral hemisphere will have 1, 2, and the third one will be with the thalamus. Midbrain will just have a cerebral aqueduct. Pons and cerebellum and medulla will have the fourth ventricle, and then the spinal cord will be continued with a central canal. Now, a few important points about spinal cord. This is a term corna medullaris. Corna medullaris is basically end of spinal cord, which in adults is at the level of L1, and in children it is at the level of L3. Cauda equina is the nerve roots formed from sacral, lumbar, and coxigeo-pelvic nerves. Coxageal ligament is formed at the level of S2 with the mixing of dura, pia, and arachnoid matter. Subarachnoid space ends at S2 to S3 level, and the lumbar puncture is normally done above L5 and below L2. The most common place is between L4 and L5. This was all about embryology. Now we will be moving on to a little histology, or the cells we have. In neurons, we have dendrites, the cell body, axon, and the terminals, which can be synaptic vesicles. The cell body has an increased amount of rough endoplasmic reticulums, which is known as missile bodies in CNS. Also note that these missile bodies are absent at axon hillox. Now coming to glia, we have oligodendrocytes which are responsible for forming myelin, and this will be in CNS only. For the peripheral nervous system to form myelin on the nerves, we have Schwann cells. Astrocytes are the cells which control the microenvironment, and they maintain the blood-brain barrier. Also note that the astrocytes are the most abundant cells in glia in the gray matter. Ependymal cells are ciliated and they line the ventricles. The microglia are the phagocytic cells which are responsible for phagocytic activities, or they're a part of mononuclear phagocyte system. So axon hillock is a point just like over here at which there is increased mitochondria, action potential is generated, and it has an all or none potential. So what happens if an axon is injured? The cell body goes into chromatolysis, which is it swells, and the regeneration and degeneration of the axon happens. So let's suppose this is the cell body and this is the axon. These are the dendrites. And here is where the injury happens. So after the point of injury, the degeneration will be in antegrade direction. This is also known as Valerian degeneration. And in the axon behind the point of injury, the degeneration will happen towards the cell, which will be in retrograde direction. After which it will be then regenerated from the cell body. Please note that the only axons or only nerves which can regenerate are the ones which are myelinated by Schwann cells. So basically, the CNS nerves cannot be regenerated. Now, an important point regarding the retrograde transport is that many diseases such as herpes, rabies, are exogenous substances that travel through the axon to the cell body through these transport mechanisms, thus causing diseases. Another important point is that the antigen presenting cell is always the dendrite. However, in intestines, it is M cells. The blood-brain barrier is maintained by tight junctions. So this is almost all you need to know about the histology. For nerve fibers, we have three basic types of nerve fibers, A, B, and C. A is then further divided into alpha, beta, gamma, and delta. Alpha fibers then have two sensory divisions, one A, which is for muscle spindle, and one B, which is for Golgi tendon organs. So remember this with the mnemonic alpha athletes. So athletes have big muscles, and alpha nerve fibers will be supplying the muscles, which is muscle spindle and Golgi tendon organ. The beta fibers of A division will be for pressure and touch. Also the proprioception. Now remember it with the mnemonic beta balance. So balance, pressure, and touch will be balanced by proprioception. This is just name mnemonic. The gamma is for intrafusal muscles. There will be a lot of MCQs asking which are the nerve fibers which are associated with skeletal pathway. They will be alpha and gamma since they are supplying the muscles. Delta is primarily for temperature and fast or sharp pain, pressure, and crude touch. Always remember delta is equal to danger. Danger means fast pain. Now moving on to B nerve fiber. These are mostly in preganglionic autonomic nervous system. Now moving on to C nerve fibers, their sensory type is 4. They mostly supply the postganglionic nerves in the autonomic system. Other than that, the very important point is that it is involved in conducting slow pain. Remember, with the mnemonic, C is for chronic, that is slow, also temperature and tingling sensation. See the green arrows over here? So with the green arrow, the diameter will decrease and the velocity of conduction will also decrease. So the fastest fibers will be A alpha 1A and the slowest fibers will be C type. Again, they conduct slow pain, so you can remember it by that. And the diameter will be similar. Greater the diameter, greater the velocity. Now, since we're done with the nerve fibers, we will be moving on to the receptor. Before moving on to receptors, please note this important point that the pain fibers are unencapsulated. So for receptors, we'll start off with free nerve endings, which are non-adaptive. It includes nociceptors, mechanical and thermal receptors. Nociceptors are pain-sensing receptors. It also involves sensing through touch and temperature. Now it involves pain, basically. The fiber type conducting the impulse will be, let's see over here. So the one involved with fast pain is A delta and the one involved with slow pain is the C fiber. So the fiber type will be A delta and C fibers. Moving to cross bulb, it is responsible for detecting cold temperature. And the fiber type then will be A delta as it was responsible for temperature. When you're going through this receptor, please have this written with you so that you can relate with it. Now, Meissner's corpuscle is responsible for fine touch. It is present in fingertips, 2-point discrimination, and a low frequency vibration. Keep in mind it's low frequency. Since we're talking about fine touch and vibration and tap pressure, it will be A beta fibers. So the fiber type will be A beta. The Pacinian corpuscles are responsible for detecting deep pressure and high frequency vibration. Again, the pressure and vibration, it will be A beta. Now, both of these are highly adaptive receptors. Pacinian corpuscle is the most rapidly adaptive receptor. Now moving on to Merkel's disc. Merkel's disc is responsible for deep touch. Keep in mind it's not deep pressure, it's deep touch, pressure and position. Since again we're talking about touch and pressure, see over here which fiber is responsible for touch and pressure. You can see for yourself it's the A beta fiber. So A beta fiber. The Ruffini corpuscle is now responsible for steady pressure. This was for deep pressure, normal just pressure, 2-point discrimination for Meissner's. For Ruffini, it's steady pressure, basically the stretching of skin. Again, pressure and stretch, it will be A beta fibers. Now, I have written the pathways over here as well. You will be able to more understand this once you have done the tract. So, free nerve ending, since it carries the pain, it will be through lateral spinothalamic pathway. The others, the 2-point discrimination, touch, pressure, they will be through dorsal column medial lemniscal pathway. The muscle spindle is present in muscles and is responsible for the muscle length. Muscle spindle, which one was it? Alpha athletes. So alpha 1A. A alpha 1A. The Golgi tendon is responsible for muscle tension. So whenever there is an increase in length of the muscle due to a stretch, muscle spindle receptors are activated. If there is an increased tension, increased pressure, the Golgi tendon ones are activated, and as we already did, sir, there are A alpha 1B. Now, the visceral nociceptors are the one which will detect the visceral pain, stretch, and ischemia. Since we're again talking about pain, stretch, and ischemia, and mainly slow pain, the chronic pain, it will be C. However, some visitors have fast pain as well, so it will be A. Danger, that's A delta. The baroreceptors are mainly responsible for detecting the distension and pressure caused due to high blood pressure. So the fibers for pressure are A beta and A delta will be over here as well. For chemoreceptors, it will be detecting O2, CO2, and chemical changes, so it will be C fibers. The pathway, we will do this in detail in CVS. You can see over there. Now, these over here, the one in yellow, are slow adapting receptors. Also, there is another mnemonic to remember. The M&M, the Merkel's and Meissner corpuscles are superficial. So the PR, which are Pacinian corpuscle and Ruffini corpuscle, they are present deep. So this was all for today's video. I hope you were able to understand the receptors, nerve fibers, and a little bit of embryology and histology of CNS. If you want more such videos, please subscribe to my channel and stay tuned for the next video. It will be on neurotransmitters, which is a very difficult topic, and I'll make it easy for you to understand. Thank you.